Welcome back to Bottles, Boobs, and Feeding Tubes. It's me, MPT, your partner from Bump to Baby and Beyond. Today I'm going to tell you the difference between a PCP, health coach, or a therapist. And how do you know which one you need, if not all three? What is health coaching? A health coach is a trained professional. Sometimes they have a medical background, sometimes they don't. But their goal is to help guide you into setting lifelong changes. It's personalized in a way where you create your goals, you decide what is important to you in your health and wellness journey, and they keep you accountable and help you along that journey. Sometimes improving goals, changing goals along the way, redoing goals. Sometimes you have to start back over when you're working with a health coach because you may have fell off and you weren't as committed to those goals in the beginning, which is all a process of going through a health and wellness journey when you're trying to make lifelong changes. How did I find out about health coaching? Well, I decided to become a health coach because I thought it was a very interesting tool, not knowing that I would be ultimately health coaching myself. Because as I learned the process of what a health coach does and went through the coursework, it started making me evaluate my own health and wellness goals. And I started to learn those goals and setting goals and achieving those goals and setting new goals and achieving those goals. So I became my own health coach, as well as finding other health coaches to help me along the way. Personal trainers may be someone that could also be certified as a health coach. A nutritionist may be a certified health coach where they're using these techniques to help you change how you're eating, increasing your physical activity. That's what a health coach is. Why would you want to go to a health coach? Maybe you're at a point in your health and wellness journey where you do not have a physical or a mental diagnosis that needs a professional or a licensed professional to help you. But you're at a stage where you've been doing the same things and getting the same results, or you're struggling with goal setting, or you're setting goals that you find yourself not being able to accomplish because they're too hard, too difficult. Or maybe you're the kind of person that does a lot of that yo-yo dieting. If you're not sure what that is, I do have a video, check it out. But if you're someone that loses weight, gains weight, loses weight, gains weight, or if it's not even necessarily weight gaining, if you might be a cigarette smoker and you've tried quitting several times and you just find yourself not being able to stick with any of the strategies and things that you've tried in the past, a health coach may be someone to kind of help keep you accountable. They help you set personalized goals. You may want to find someone that might be relatable, that had a similar journey, and they may have strategies that help pull them out of that cycle of not being able to set and accomplish goals. If you're someone who has a lot of stress and you're trying to eliminate your stressors and you're just trying to really figure out how to manage life, time management skills, things like that, that may be your need for a health coach. What is a PCP? A PCP is a primary care provider. Their focus is on diagnosing and treating. You will go to a primary care provider for your annual physical. It's for preventative health. If you do not currently have any medical conditions, but you're going in, you're getting your labs done, you're getting all of the tests done to make sure you are not having any concerns at this time. Your blood pressures are good, your blood sugar is good. That's the focus of a primary care provider. And then if you go in and you find that you have maybe high blood pressure, a thyroid disorder, or if you need a specialist, we need to refer you out to a stomach doctor because you're having a lot of stomach issues. If you're having headaches and you need to go see a neurologist, that is the primary focus of a PCP. We are to help diagnose, provide medications as needed, as well as help you direct your care on whatever problems you may be experiencing. Why would you go to a PCP? Everyone needs a PCP, even if you're healthy, even if you're young. They are the ones that you would talk to first. Anything medical related, but also preventative care. If you're looking to prevent diabetes, high blood pressure, you would want to go to them to get a baseline to see where your numbers really are. Are you at risk? If you're overweight but you don't have high blood pressure or diabetes, if you're pre-diabetic and you're trying to prevent having diabetes, if you have a family history of thyroid disorders and you're trying to make sure you don't have that. So a primary care provider, everyone needs one. How often you go see them depends on your overall health and wellness, and they can diagnose, treat, or refer you out to a specialist if you need it. Now, a therapist is there for your mental health. They're there to help you work through past traumas, if you have anxiety, depression. Some are prescribers, so they may prescribe medications. Some do talk therapy. Some may do cognitive behavioral therapy. They may have different types of tools to help you work through your mental health. When would you need to see a therapist? Well, if you have depression or anxiety, if you're bipolar, if you have a history of schizophrenia, those would be the diagnosis where you would need to see a therapist or a psychiatrist, psychologist. They will help you work through your mental health. Even if you don't have a diagnosis of depression and anxiety, but you may have past traumas that are showing up in your life where you're having problems dealing with stress or having problems with making connections with family members or friends, they can help you work through those situations. Why would you go to a therapist? I also say everyone probably needs one of those. But therapy is good if you're suffering from mental health problems such as anxiety, depression. Even if you don't have a diagnosis, but you're battling some childhood traumas, if you've experienced a trauma, if you have problems sleeping, if you're not able to relax, but you're not really anxious, but you need coping strategies to help improve your mental wellness, that would be a therapist. Now that you know the difference of a health coach, a PCP, and a therapist, you can evaluate where you are in your healthcare journey and determine which one works best for you. If you've used a health coach, let me know in the comments. If you've gone to therapy, let me know in the comments. Do you have a PCP? Let me know in the comments. Don't forget to like, comment, and subscribe to our channel. Check out our other videos, and thank you for tuning in.